Hi, welcome to Public Health Today. My name is Christine Wilder.
Hello, I'm Marytza.
We'll be looking at whether or not the government should regulate the sale, advertisement, and distribution of junk food.
Right.
My position on the matter would be yes, the United States needs some sort of regulation of junk food, if it is through the advertisement, the sale, or the distribution. Why? Well, obesity is a huge problem, in our nation. We see that 68.5% of Americans are obese, and that rises healthcare costs for taxpayers, among an array of other things.
Well, I think to disagree with Christine here, I think that this is not a regulation that should be happening and that people will be upset and they will be mad. And so, reason is that food is emotional. People will be, that's their comfort food, and people will be upset that you're taking their freedom and that you're telling them what to eat, what not to eat, and how much to eat it, and what you can buy, what you can't buy, and that's going to be a problem in the country if that happens.
Well, I would definitely agree that yes, there's going to be some uproar to some extent, throughout the United States. But if we look at history, we look at countries that are implementing programs that are like fat tax, so
Right.
taxing junk food or regulating what can be aired on TV. There are successful stories in France and Netherlands. So I think people would get used to it.
I found something completely different than what you're talking about. I mean, yeah, those, they worked for a little bit, but for example, like take Denmark. Denmark implemented a fat tax, so to say, and people were very upset. People were crossing over borders to countries like Germany to get food and like things like butter, milk, and eggs, and bringing them back because it wasn't cheap where they lived, and it wasn't feasible for them to buy these things. And that only lasted a year, and they had to completely scratch the program because it did not work for Denmark.
Well, I'm not saying tax buttermilk and eggs. I'm saying more so McDonald's or your Lay's potato chips. But, we see throughout the United States, if we look back even into our personal history, that the United States taxes tobacco and alcohol, these things that are linked to harmful, chronic diseases for Americans. And, we can do that, but we can't even address the obesity issue that is also linked to death, just as tobacco and alcohol.
Right. I mean, I think that something should be done, and that's where we differ on how to do that and how to be the most, how to get the most effective solution. The problem here is that I don't think that regulation and taxing is the only solution to this. For example, we have other alternatives like teaching people how to cook because people are not cooking as much now, and they want their easy made, the ready, hot, microwave, foods nowadays, and people are not cooking. So that's something that we can implement. We can educate people. We can teach them how to exercise a little bit better, or eat less, or just be more active in generally, and that could work too. But just taxing people is going to feel like a punishment to others, and it's probably not going to work in a country like the United States.
And I would agree that those are great other methods that could be used to combat the obesity problem within the United States. And we see that Michelle Obama, is having her own programs, get us
Yeah, the Let's Move program, which I love.
But I don't think that's enough. I think those paired with a junk food regulation or like even on the advertisement side needs to be necessary. Just because what are people going to like? That's a passive thing. They can opt to whether or not participate in these activities, but if there's a tax, they have to participate in these activities, and it's for the betterment of the nation as a whole, rather than one group of people who don't want to pay because they're healthy and they're not obese.
Right. I mean, I kind of agree with you, but not totally, because then what happens is that these companies and these manufacturers are going to start making or are going to keep making or producing these types of products that are unhealthy for people and not good, and they're causing the kinds of diseases that you were talking about. But the consumer is the one taking up that cost. And if, for example, if we were to, put that cost onto the manufacturers or regulate them or give them some type of time so that they could, change their products, that could be something different that people would like.
I think there's a lot of work that needs to be done, and even more,
Agree.
Research done on this, and even maybe going into government subsidies. But we'll have to talk about this at a later time because that's all we have for today. So.